bring in, please let me know. Our order today, what we're going to do, we're going to have a panel of some really distinguished people. First, we're going to have Dr. David Lowe, and I'll introduce him after I do the format. Then that'll be followed by Dr. Evelyn Vasquez. And then we have a panel of 3 of our health workers from Eastern Coachella Valley. So I'm really excited. I don't want to take up too much time because we're starting just a couple of minutes late. First and foremost, I try to do a little bit of due diligence, and Dr. Lowe is a senior associate dean. He is also a distinguished professor at UCR, and he is also the head of the Health Disparities Research Center. And so what I liked, though, in doing all my research was I found out that Dr. Lowe went to University of Pennsylvania. And as a kid growing up, I used to go sit on the campus of UC Penn because it was like the best place to go in town. So when I saw that, I was like, now I know why we connect so well, because I used to kind of go there to get my energy. That was the place where I charged myself up. As a kid growing up in Philly, the chances of me making it out were considered very slim. The topic we're going to talk about today, health disparities, and particularly brainstorming for solutions that deal with community wellness, is really near and dear to my heart. So, when I first showed up for this panel, when I first showed up in the program with those guys, they were doing introductions. And so they were like, here's Dr. Lowe, and here's Dr. Cherney, here's Dr. So-and-so. And then it was John Epps, right? And I was a little bit taken aback, right? I was like, why am I in the room? But the one thing I believe is really important in the work that we do is the connection between research and the communities that the research serves. And if I have been impressed by nothing else in my participation in this group, it is how often that question comes up. How are we going to apply this in the community? Or what does the community think about this? And so it is my privilege and my pleasure to first start off with Dr. Lowe.
Thanks, John. I think this will be this is a very timely topic. And although we know there had been a lot of ongoing issues, I think a lot of the COVID pandemic has really highlighted the very real problems that we've been trying to address. So I just want to give a perspective, a few slides on what the issues are that may be discussed in this session. So this is one perspective, my perspective from being in the ivory tower. It's as much as Riverside has isolated itself from the community. As John mentions, the University of Pennsylvania was in the past was one of the worst examples of that town gown distinction, but they've made huge strides in recent years in really reaching out to the community. So that's an instructive lesson there. But with regard to the pandemic, I wanted to talk about whether or not we are able to effectively communicate with our community and really develop a kind of community-based approach to solving the public health issues that we face. And, there have been people talking about, the pandemic was a great equalizer. It was exactly the opposite. It actually only highlighted the existing disparities in terms of access, outcomes, things like that. And so that's really been a problem. And the question is, how do we approach this? And what have we failed to do? And why are we really behind the curve on doing this important aspect now? So just a short list, there's already suspicion and skepticism in the communities with authority, the medical, the healthcare system, and so on, as well as where people get reliable sources of information. And the question is, do we actually know what we're doing? And I'm going to show you a few quick slides illustrating how really bad we are at this. So I was looking around at the various University of California School of Medicine websites and finding out, where do I find information about COVID? How do I understand what's the disease? How do we protect ourselves? Things like that. And mostly I found really poor sources of information. This is screenshots from a video on the UCLA website. And the most they could say is that the disease could affect your lungs. That's all. There were a few slides on the signs of being sick, which basically are indistinguishable from whether you had the flu. Then they say, well, let's talk about masks. And the very next slide was just a website saying, well, it depends on where you live. It was really totally useless. Even our own website, UCR Health, and we'll probably get people mad at me, but our own UCR Health website has a frequently asked questions page. And it really skips a lot of the basics on what is the disease and things like that. And it was more about questions about, making an appointment or getting a vaccine set up and things like that. The consistencies I see on these websites is that they jump to these issues of like setting up a vaccine appointment and things like that, but they haven't gotten you there in terms of understanding the disease. What's the experience? What are these other issues? And they really don't address the specific needs of certain communities in getting the kind of information that they need. Here's the UC Irvine site, same thing. They jump straight to the vaccine eligibility. They don't actually have links to any information on the disease itself. UCLA Health, I showed you slides from the video they had, which was, not as helpful as I had hoped. And I will admit, in my own work, we've been a little bit passive about it in the sense that, I've responded to requests for information on the disease and vaccine. And so here's one where our own communications had a neat little article, and it's like, what are we looking forward to and things like that. But it was really more about a timely topic, is the pandemic here to stay? But really, even on our own website, there's not as much information about the disease itself, transmission and things like that. So this was more of an academic exercise rather than a community outreach exercise. We also developed a series of videos on Vaccine 101, because I know that one of the concerns in the community is, can we trust the vaccine? What is this vaccine? Why did it happen so fast? Are there things we have to worry about? And we put together a series of 7 short videos, only like 3 to 6 minutes long. Unfortunately, I cannot find the links to that video on our own medical school website. And there's no links to it on our university website either. So we do a really bad job of giving people access to information. This is just another one where this was tailored more to the university community, the campus audience, what are the concerns about it? But also, again, it doesn't reach beyond the borders of the campus in terms of trying to reach out to the community. Now, that's not entirely a bad thing. We do have a mission to reach out to our own campus community as well. And one of the examples is we did a live conversation with the director of the Center for Ideas and Society. And in this case, I don't know if you find this amusing, we had to do our own outreach to the humanities community on campus. And so we had this extended discussion on vaccines and, what is the future of in terms of the pandemic and things like that. So it was tailored to a community, but it was very much within the boundaries of the campus. And again, is really not as helpful to the outside community. Now, having told you all these things that are really depressing, I wanted to show you where you can be really effective. And I think, John, you were at this session too, weren't you? This was, I was blown away about how effective this was. This was a live session that was outreach to the Black community Michelle Burrows moderated this event. And a few things I wanted to point out about what made this so effective. It had stories told by Black patients about their experience with the disease. It had information from a series of Black physicians in the community telling actual information about the disease, about the vaccine, treatments, and things like that. So it wasn't just, here's information, live with it. It's like these are personal lived experiences. And so for people to develop a trusting relationship with these messengers and the information and plan of action and things like this, I think this is really the model that we want to follow in terms of communicating effectively and getting people on board with what the next steps need to be. And so I think that contrast that I just showed you is really answering that question, where are we failing? If it's a question of saying, what are the frequently asked questions? Well, who actually came up with these frequently asked questions? Because they aren't questions that people in the community may be asking. Are we identifying the different communities? Because each of our communities has different ways of receiving information, different ways in which they communicate within the communities and between families or things like that, and identifying how they identify with sources that they can trust. And that's a really important thing, because with social media and so on, misinformation spreads so much more quickly. And even now, it's amazing to hear how often people are worried about being microchipped with those vaccines. And Bill Gates is trying to peek into your deepest thoughts and things like that. And we are not good at combating that kind of problem. So I will leave it there, and hopefully we will begin to have a conversation about how we can more effectively address these problems.
Thank you very much. That's really appreciated. And I think, again, the idea of this is lived experiences. This is what the voice of people in the community are saying to the community is really important for establishing that trust and overcoming a lot of the suspicion that unfortunately has developed because of either misinformation or mistreatment in communities, especially communities of color. And so now I'd like to introduce our next guest, and that's going to be Dr. Evelyn Vasquez. And she's with the Social Medicine Population and Public Health Department. And again, I was really impressed. I saw that she did her work for a bachelor's and master's in Mexico. And she's one of UCR's own in her doctoral aspirations. And so now I'd like to go ahead and toss it over to you, Dr. Vasquez.
Thank you so much for the introduction. Good morning, everyone. Thank you for being here. We appreciate to hear your thoughts and questions after our presentations. So as well as it was mentioned, I did my PhD at UCR, and I'm now a postdoc at the School of Medicine, and Dr. Cheney is my mentor. So thank you for being here. Also, sorry, can the first one? Yes, thank you. I just wanted to share that this research that I'm going to share with you is part of a research project that started from UCR Healthy Campus, which is a collective project that aims to increase healthier behaviors and healthy practices on campus. And here are the names of the 4 people who were involved in the research design, also data analysis and data interpretation. For the data analysis, also we had a great group of undergraduate students who were trained and also helped us conducting and also analyzing the data. So, well, unfortunately, infectious disease have disproportionately affected underserved, under-resourced, but also underrepresented in socially marginalized communities across the globe. And in the United States, this is not the assumption. The COVID-19 pandemic, which is the respiratory disease caused by the SARS-CoV-2 virus, has magnified health disparities in racial and ethnic minority populations. So as you may see that there is this great graphic that was developed by Harvard. So these minority populations are more likely to not have access to testing, to live in high density neighbors, and also to be exposed to pollution, have a persistent conditions, and also be an essential workers. And on the top of all this, they are also facing a racial bias in healthcare. So now, as we know that, plenty of higher education institutions are planning to go back to campus. So now our responsibility is what can we do, to create a safe environment that minimize the exposure of all our communities. Also, we have to be mindful that UCR is one of the most diverse campuses in the entire country. So that means that we have a high rate of students who are low income, also high rate of students who have 2 jobs as well, or 1 job, where also are enrolled in full-time. So we have to be mindful of all these important characteristics, and rather than just making all these assumptions that, well, if the universities in the East Coast are doing this, we can do the same, because our context and our student population is really unique and different. Next slide, please. So the purpose of this rapid qualitative research was to explore COVID-19 health-seeking behaviors in the context of higher education institutions. And the main purpose of this project was to identify safety measures to reduce virus spread and discuss community-informed public health messaging to promote COVID-19 risk reduction strategies with campus communities. Next slide, please. So these are some of the research questions that we responded in this manuscript. So what I'm presenting is part of a manuscript that we have been working on. It was rejected once, but we are working on the resubmission to another journal. Next slide, please. So what we use is the theoretical framework to respond to our research questions is the socio-ecological models. So these models have been used widely to inform how changes in the social environments promote changes in individual behaviors. So particularly in the context of the current pandemic, the intersections of micro, meso, and micro level processes influence the norms, values, and belief systems of communities, as well as individual level attitudes, knowledge, and health-related behaviors. So for the particular case of micro level, we're talking and we're thinking about individual level attitudes. So that means what one person can do. So at the meso level, we're talking about these interactions within groups or also within organizations. And then when we're talking about the micro level processes, it's more broad, and it's talking more about the political sphere or the social structure where we are belonging. Next slide, please. Thank you. So we conducted, as I said, this rapid 6-month exploratory study, and we conducted 9 focus groups. So we have a total of 113 participants, and all of them were part of different stakeholders groups, where some of them were students, others were faculty, and the last one were also staff members. Next slide, please. Thank you. So this rapid qualitative data analysis also is really important in the current context of the pandemic, because it allowed us to identify patterns across the 9 focus groups, and also to go to go more in deep into the belief systems, but also, to understand the myths and the sources of misinformation that some aware community members might have. And then for the data analysis, we followed three main steps. One was the transcriptions on the interviews. Then we completed a summary of template for each focus group, and that was like the data reduction strategy. And finally, we have this matrix analysis that allowed us to create a cross-case analysis among the three stakeholders groups that we included in our study. Next slide, please. So some of the main findings for this project is that participants perceived risks that changed depending on the spaces that they occupied and the information that they consumed. So there is a sense of risk for contracting COVID-19 based on other people's attitudes and behaviors in public spaces. Also, participants perceive a strong relationship between sources of public health misinformation and COVID-19 risk. So one of the main aspects that were discussed is the generational gaps, or but also the different behaviors among different ages. So for instance, young people tend to get all this information in social media compared to more old people that they are consuming TV channels that usually are more traditional, but in both spaces, the misinformation exists. So our participants were talking about the importance to provide a baseline understanding. And again, as what Dr. Lowe was mentioning before, the importance to provide accessible knowledge, accessible information, so everyone can understand what is there. Because what's the point to share all this very scientific information when the community, they cannot understand what are we talking about. So by providing this very specific information, we are creating barriers and we are not helping to our communities that are suffering the most. So next slide, please. So now I'm going to share some of the quotations that were shared from our participants. For the particular case of this of the theme of public health misinformation, some of our participants says that a lot of people don't wear masks because they think like it's annoying to wear it or it's hard to breathe in it. It's frustrating when they say that because there's people in hospitals right now that are intubated and they need to be on a breathing machine, and you are complaining that it's hard to breathe with the mask on. That's frustrating that people are being selfish in that way. The purpose of the mask is to prevent possibly you from spreading it to others. So what we're seeing here is how people are reflecting and how people are also recognizing their personal responsibility into this pandemic, but then also talking about how others are behaving in their surroundings. So next slide, please. So what we identified here is that there are values shaping the use of public health safety measures, and that these values have been discussed particularly in how the American societal value of personal freedom outweighed social consciousness and the shared responsibility to protect selves and others. So all of our participants were aware of and knowledgeable about COVID-19 measures on how to reduce the spread. And most of them follow public health guidelines. Next slide, please. Thank you. So in regards of personal freedom, this is one of our participants share. There is this emerging perspective that wearing a mask is a personal choice, for example. A distant uncle of mine in the Midwest just passed away. I was reading his obituary, and for the memorial service, masks are optional, but it is a personal choice. It is how they framed it there. This is super puzzling to me. It's super opposed to this idea of social responsibility that is not a personal choice, but it is a choice that you make for your friends, your neighbors, for everybody else. I view this as a big barrier to why people are not wearing masks, because they are framing it as something that I can choose to do or not for myself. Next slide, please. So this is another view of personal freedom. Participants emphasize the uniqueness of this value to American society. Americans have a perspective on freedom in terms of freedom to do blah, blah. Just north of us, the Canadian perspective on freedom is more a freedom from disease, poverty, etc. This value of freedom sets individual choices to wear face coverings. I'm free to choose whether I wear a mask reflects that American view on freedom. Next slide, please. And then also we have some participants that were embracing this notion of social responsibility. So this participant explained that I want to go and meet my friends, and I would love to go and have a bunch of fun outside right now. But I feel like everyone has their own responsibility towards the general public health. And it's just frustrating to see people not social distancing, to not wear masks and be in close proximity to each other when other people are going out of their way to quarantine and stay home for the general well-being of people. Next slide, please. So for our discussion, participants share that the importance of having a combination of top-down and ground-up solutions focused on community building and school spirit, that this might be a good and effective strategy to follow. For instance, they were talking about how mascots create these school spirits, right? Like how these mascots also allow us to follow collective purposes. So it's like, okay, how can we share that notion of inclusion, respect, but also the recognitions of individual differences in aims to create a safe space and to decrease the spread of the COVID-19 on campuses. Also, I'm sorry, can you go back? Thank you. Also, grassroots approaches can include bringing students, staff, and faculty together to identify ways to use mask wearing and face covering to build community again. So universities, and this is what's really important, can partner and should partner with departments of public health to rethink messaging to incorporate individual experiences and promote alternative COVID-19 safety measures. One of our participants talked about the sense of cannot breathe with a mask, right? So they were asking and recommending us as well to maybe reshape that messaging. You know, that some people have this psychological experience that they cannot breathe with a mask, and we should not minimize those experiences, but we need to be able to address in a proper public health perspective way, how can we help those who have this psychological experience when they were wearing masks, because this is something important. And this is something that some participants have been experiencing as well, and others in their communities. Next slide, please. Thank you. So my conclusions is that by engaging members of communities in rapid qualitative research studies, investigators can collect cross-cultural insights into the complexities of the attitudes toward the use of COVID-19 public health safety measures. And then also, well, this article and this research advocates to bring together campus and public health leadership with grassroots leadership effort to develop a shared vision and incorporate values that speak to all within the campus and surrounding communities. Thank you.
Well, thank you very much. That was really good. I really like the idea of bringing together the groups to really think about the messaging that we're putting out. So again, thank you so much. And now our final group of panelists are from Eastern Coachella Valley. They've been out there working on the COVID-19 testing and public health education for farm workers, for farm working communities. And I think I mentioned I worked out in Eastern Riverside County for the Regional Access Project Foundation. And, you know, that population of farm workers is in a really high risk situation for lots of different reasons. So that we would have 3 of our students out there doing work is great. So I want to introduce you to Karina Bella, a 2nd-year medical student at the UCR School of Medicine, to Ashley Moran, a 3rd-year undergraduate, and then Sonia Rodriguez with the Health Disparities Research Community Promotoras. And so please take it away.
Buenos días. Mi nombre es Cintia Sánchez y soy un segundo. Catherine, si quieres lo puedo hacer share si estás teniendo problemas. Okay. Ok, buenos días, mi nombre es Cintia Sánchez y soy una estudiante de medicina de 2º año en la Escuela de Medicina.
Buenos días, mi nombre es Ashley Moran. Yo soy una estudiante de 3er año de biología en la Universidad de Riverside.
Buenos días, mi nombre es Sonia Rodríguez. Yo soy un promotor comunitario de la salud en el este del Valle de Coachella.
Gracias por estar con nosotros esta mañana y nosotros vamos a presentar en valores individuales versus colectivos en el este del Valle de Coachella. Y esta presentación es parte de una investigación grande que se hizo con la ayuda de la doctora Chini y también Dr. Evelyn Vázquez. Okay, primero vamos a hacer la introducción, después el diseño del estudio y métodos, una discusión, lo que hemos aprendido y después hablaremos de lo que piensan ustedes. Entonces, como dijo el doctor Fauci, siempre ha habido disparidades de salud y siempre han existido en comunidades vulnerables como la comunidad afroamericana. Y en este tiempo de la pandemia estamos viendo cómo esta población está sufriendo de manera desproporcionada con el coronavirus. Y es por eso que nosotros decidimos hacer esta investigación en el este del Valle de Coachella, porque también es una comunidad vulnerable y una comunidad que ha tenido unos números muy altos de COVID-19. Como mencioné previamente, comunidades de color han sido afectadas desproporcionadamente durante esta pandemia y esta investigación se enfocó en la población Latinx del Valle del Este del Coachella y tuvimos grupos focales donde hablamos sobre sus pensamientos del COVID y en esta presentación les vamos a compartir valores individuales y colectivos de miembros de la comunidad. Sonia.
A nosotros, como promotores de la UCR, la doctora Chini junto con la doctora Evelyn nos dio la oportunidad de realizar grupos de enfoque. Estos grupos de enfoque fueron realizados por promotoras que fungimos como facilitadores y fueron dados a miembros de la comunidad. Siguiente. Diseño y métodos de estudios. Gracias a la realización de estos grupos focales, pudimos obtener una valiosa fuente de datos y en esos datos pudimos obtener lo que son las creencias, los pensamientos de la comunidad que ellos tienen respecto al COVID. El hecho de haber hecho un focus group con promotores y miembros nos permitió escuchar sus pensamientos y expresarse sobre lo que piensan del COVID-19. En estos grupos, como lo mencioné anteriormente, nos dieron a nosotros como promotores comunitarios la gran oportunidad de facilitar. Estos grupos fueron 7 grupos y estuvieron establecidos en un promedio de entre 6 y 10 personas que integraban la comunidad. Debido a la pandemia, estos grupos fueron por grupos de Zoom y todo lo que cada uno de las personas integrantes de ese grupo, había un tomador de notas, se tomaban las notas y después se usó una transcripción con un profesional para tener una validez de ese estudio. Pudimos también, después de estos grupos focales, hacer un análisis de grupo que también nos dieron la oportunidad a las promotoras de integrarnos y hacer un análisis de grupo. Fue una experiencia y valoración de estos estudios porque nosotros somos un vínculo para la comunidad, pero ahora nos han permitido extraer la gran información de lo que valiosa del grupo focal al hacer nosotras también el análisis de esos grupos focales. Diseño y métodos del estudio. Ok, el diseño fue el grupo focal. El método que nos introdujeron a nosotros a realizar este grupo focal y también analizarlo. Porque nosotros, el concepto de los promotores somos unos vinculadores entre las organizaciones para poder llegar con la comunidad. Somos trabajadores de la salud, no profesionales, pero que organizaciones como la UCR nos capacitan para que nosotros podamos llegar a los hogares de la comunidad con pocos medios y poco alcance o con miedos para expresar sus ideas y sus preguntas. Nosotros les llevamos ideas, información precisa y les damos un lugar seguro para que ellos discutan y nos hagan preguntas sobre temas difíciles que ellos solos no podrían llevar a altos mandos. Nosotros esos somos los promotores comunitarios, la conexión, el vínculo de organización con comunidad. Gracias.
Gracias, Sonia. Y para seguir en esta presentación, queremos introducir una observación que hicimos con estos grupos focales, y esto es la diferencia en los valores entre la comunidad americana y lo que vemos aquí en los Estados Unidos en la media y la población del Valle del Este de Coachella. Entonces aquí tenemos un video para mostrar lo que se ve por las redes sociales, las noticias, y cómo en nuestro pensamiento la cultura americana tiene valores más individuales y, por ejemplo, cuando se dice su cuerpo, su decisión, es algo bien importante para ellos cuando estamos hablando de las mascarillas, de la distancia social y temas como estos. Entonces vamos a mirar este video corto.
Cynthia, I think you need to share the sound.
To cover one's face is true. You have to wear a mask. You could call it a mask mutiny.
Wearing a mask can actually cause you to get sick. So,
Wearing a mask can actually cause you to get sick.
yeah, absolutely.
That claim may be false, but the growing refusal to cover one's face is triggering a crackdown on airplanes.
I mean, I don't like wearing a mask.
Well, I'm going to ask you to promote the aircraft.
American Airlines and now Delta confirming they've banned passengers for refusing to wear masks on board. And after scenes like these when Las Vegas reopened, Nevada's governor now making masks mandatory across the entire state. And he's not the only governor. Wearing a face covering in public, now mandatory in 18 states. It's a requirement that's making some people very unhappy.
You literally cannot mandate somebody to wear a mask.
In Palm Beach County, Florida, where a mask ruling just went into effect, residents up in arms.
The fact of the matter is, it's our bodies, it's our choice whether we're going to wear them, not wear them. You guys are overstepping your boundaries 100%.
And in Arizona, where they hit a record number of COVID hospitalizations this week, a councilman in Scottsdale under fire after appearing to mock the dying words of George Floyd and Eric Garner as he protested wearing a mask.
I can't breathe. I can't breathe.
He later apologized. And at
Gracias, Cintia. Entonces, como podemos ver en este video, muestra bastantes sentimientos de que no quieren ponerse la máscara, que piensan que es una violación de sus derechos. Y esto es interesante porque en nuestros grupos de enfoque con la comunidad del este del Valle de Coachella, vimos que los resultados eran que ellos tenían pensamientos más colectivos y un poco opuesto a lo que vemos en este video. La siguiente slide, please. Por favor, Cintia. Entonces, para comenzar a hablar de nuestros resultados, cada grupo de enfoque fue guiado a través de una serie de preguntas para obtener sus creencias y las percepciones de la comunidad. Y lo que encontramos fueron dos diferentes cosas, la responsabilidad individual y la responsabilidad colectiva. En el lado individual, lo que escuchamos de nuestra comunidad fue que el uso de la máscara es algo individual. Ellos mismos se hacen responsables de lavar las manos, de mantener la distancia social y toman medidas de precauciones ellos mismos para reducir la transmisión del virus. Y otra cosa que ellos también hacen individualmente es hacerse la prueba del COVID. Y en el otro lado, la responsabilidad colectiva es que en los grupos focales muchas personas mencionaron que por el respeto a los demás y por su comunidad están siguiendo las reglas del COVID-19. Otra cosa que se mencionó es que querían evitar la congregación de personas. Algunos dijeron que personas en su comunidad todavía estaban teniendo como fiestas o reuniones grandes y ellos piensan que como una colectiva comunidad deben evitar eso. También tenían muchos sentimientos de proteger a sus familias y tener conciencia. Eso fue una palabra que escuchamos mucho en nuestros grupos focales. Todos pensaron que es algo importante en esta situación y que su comunidad como colectiva necesitaba tener conciencia en sus acciones por el bien de su comunidad. También piensan que algo importante es compartir información y eso es parte de lo que hemos estado haciendo con este proyecto. Una de las metas es compartir esa información para que los miembros de la comunidad lo puedan compartir con sus comunidades y con sus familias. Y otra cosa es que las creencias y actitudes sobre la salud pública, el gobierno y los proveedores de salud. Eso también es algo que estas personas tienen valores colectivos hacia eso. Y también una nota es que estos grupos focales fueron antes que la vacuna del COVID existiera.
Gracias, Ashley. Aquí nomás les voy a enseñar algunas de las cuotas que algunos de nuestros participantes dijeron que nos hace pensar, que nos hace ver cómo ellos piensan más en comunidad en vez de individualidad. Como les voy a leer dos, como es la conciencia de cada familia, es la conciencia de cada uno de nosotros. Entonces, creo que tenemos que hacer conciencia hacia todos los ciudadanos. Aquí se habla de que lo tenemos que hacer por el bien de todos, no nomás por el bien de una persona porque es su cuerpo y no de lo demás. Unos resultados que vimos fue que Muchos de los participantes están asustados por el coronavirus, piensan que la gente no debería reunirse. Los participantes quieren proteger a sus familias y a sus comunidades y piensan que la comunidad necesita un poco de más conciencia sobre el coronavirus.
Gracias, Cintia. Entonces, después de hablar sobre nuestros resultados, queremos ponerles la pregunta de qué piensan sobre lo que han escuchado. Y algunas preguntas que pueden tener en mente durante esto es que en sus comunidades, ¿qué tanta importancia tiene la conciencia? ¿Qué podemos aprender de los valores de la comunidad del este del Valle de Coachella? Y si su comunidad tiene valores más individuales o colectivos acerca del COVID. Los valores comunitarios son muy importantes y podemos usar este tipo de pensamiento más durante esta pandemia y tenemos mucho de aprender de esta comunidad y también le queremos dar las gracias a la doctora Ann Cheney por ayudarnos con este proyecto y por su liderazgo y sus esfuerzos con la comunidad del este del Valle. Gracias.
Thank you very much. That was really good. I enjoyed using the translation system. That was really very helpful. And again, I think it's really important to recognize this value conflict, right, between my personal rights and what are my rights or what is my responsibilities to my social group. So I thought this was really good. Time is starting to run down, and I was looking in the chat. I didn't see too many questions. So if you have a question, please put it in the chat, and so we can get that in. But I want to say, I want to ask a question because I was thinking about this. But before I do, I just want to first and foremost, again, thank you for attending today. And please know that the PowerPoint slides you saw today will be sent out to you. So, you know, you'll have a record of what we're doing. I see a question in the chat and my Spanish is not good enough. Is that just a thank you? Maybe that's just a thank you. So I'm going to ask this question. And this is open to any of the panelists, but what are some of the challenges and opportunities maybe that you've encountered while trying to investigate the COVID-19 pandemic for your research project? What are some of the challenges, and maybe what are some of the things that you think are really good opportunities in the community that you kind of uncovered as you were trying to do your research? Dr. Lowe?
Well, actually, in the last session, it came up where we're trying to study asthma in the kids in Eastern Coachella Valley, and trying to set up a clinical study is really tough because pediatricians and family medicine physicians don't do very much in terms of in-person visits anymore. And so if you're trying to actually do a workup and, you know, do these kinds of studies on, you know, doing the history and physical, if they're not there physically, it's hard to do a physical. And so really trying to set up a study on some of these kinds of things is a real challenge. And you know that, you know, if you feel that you have symptoms of COVID too, they a lot of places will basically say, well, you know, don't come in here, just call us up, right? So it's like that whole aspect of the pandemic shutting down personal contacts inhibits a lot of just, you know, working as a physician, but of course the related problem in doing in-person research that is really needing to have the contact with people in the community.
Thank you. Thank you. Anybody else? Any other panelists have anything else they want to add?
At the beginning, we had, like, the design of the study was different. We actually had a Qualtrics, and we were planning on asking these questions in the testing centers, and then with our community members, asking them to give it out to patients. But that wasn't really working out, which is why Dr. Cheney had the idea of focus groups. And even though it's like this community doesn't really have access to internet and a laptop and everything, somehow we were able to reach out the community, and that couldn't have been done without the help of the promotoras, because they're the ones that went out in the community and spread the word out about this study that we were doing. And that's how we were able to get some people to come into the Zoom sessions. So that was a barrier that we could have just like been like, oh, we were just not able to read the population. But having Dr. Chinny with experience of other ways to do a study, we were able to change it up and be able to get the ideas of this community in a better way.
It's always good to have a great advisor. That's good. That's good. All right. One last thing. Did you, any of the researchers, did you identify any particular community partners that you thought were helpful or that were able to assist in some of the research work that you were doing? Anybody? Community partners?
I mean, we have a lot of community partners in the Eastern Coachella Valley at this point now. At the beginning with testing, we partnered with Coachella Valley Volunteers in Medicine, which is a nonprofit free clinic located in Indio, which is like 30 minutes away from the Eastern Valley community. I know Dr. Chinny also worked a lot with the Desert Healthcare District. She received a grant from them to do COVID-19 testing. Of course, IEHP provided us with donations like hygiene bags and stuff like that for the community. Who else? Borrego Health, the food bank. Yeah, so this was all community work. Like it wasn't just UCR doing all the work. We were partnered with as many community partners from the Coachella Valley and people that have experience. One of them was Rosa Lucas. She's been a nurse practitioner in the Coachella Valley for like more than 20 years. So she herself has many community networking in the area and was able to provide us with a lot of helpful advice.
That's super. That is super. Well, two things. In the chat box, there was a reminder that there's going to be a little bit of a rest break after this session. So please, take your break, but then make sure you get back because everything that I heard is very good. Somebody put into the chat box the Galilee Center, and I've worked with them very closely in the past. Good people out in the desert, and it really helps. Not just in terms of access, right? I think that's really important, but also credibility. Because again, these are people who have been on the ground in those communities for many years. I want to again thank each and every one of you for your participation today. Can we give a little bit of applause for our panelists? I think they did a wonderful job today. I think knowing that they're out there, I believe that we're going to make a difference, that the communities will improve. I also want to thank each and every one of you for being a part of this. I think the more educated we become, the more informed we become, then the more we can address a lot of the issues that we talked about today. And I think the communities are beginning to recognize who you are and what you're doing. And I think it's really important to let them know how vital the work you do. Sometimes there's a disconnect, right, between the work you're doing and the people you're doing it for. You want to make sure that you never leave out the folks. And so on behalf of UCR School of Medicine, for Dr. Cheney for inviting me to do this, which, I was terrified. And so, but I survived. So thank you all very, very, very much for coming today. Have a marvelous weekend and, but get back for the next session. Okay. Have a great day.
Bye, everyone.
Bye-bye, guys.
Bye-bye.
Thank you, everyone. Bye.
Thank you.
Adiós. Muchas